Hi, my name is Dr. Antidote, and I will be doing your cranial nerve exam today. How are you doing? I'm good too, thank you. Before we get started, can you please confirm your name and date of birth? Perfect, thank you. Have you ever had a cranial nerve exam before? You have? Yes, so you have 12 pairs of cranial nerves in your body, and those are the nerves responsible for your senses. So they help you see, hear, smell, taste, and feel as well. Yes, exactly. So today we're going to take a look at all of them and make sure that everything is working properly. Okay? Good. All right. So one more question. Have you noticed any symptoms recently related to your senses? For example, blurry vision, any issues with your smell or hearing? Okay, none of that? That is good. All right. So the first thing that I would like to do is to listen to your heart and lungs with my stethoscope. Okay. So yeah, so just breathe normally. Okay, now please take a deep breath in and out. In and out. Okay, again. And out. Okay, one more time. And out. Okay. So everything sounds good. I didn't hear any heart murmur or anything like this. So I'm going to write down that everything seems okay. Okay, the next thing is that I'm going to take your blood pressure. So do you have an arm preference for the blood pressure cuff? This one? Okay. So I'm going to place the cuff pretty tight around your arm, and I'm also going to listen with my stethoscope, okay? Yes. Right. Let's place this pretty tight. Alright, so your blood pressure is 120/80, which is actually considered the perfect blood pressure. So congrats on that. I'm going to take off the cuff. Right. So the next thing that I'm going to do is take your temperature with this digital thermometer. I'm just going to use it on your forehead, okay? Right. Okay. 98.3, this is very good. So let's move on to your vision. And the first thing that I would like you to do is to take a look at this eye chart and try to read the lines for me, okay? So starting with this one. Here. This one. Can you see this line? And this one. Excellent. You did very well. So now I'm just going to show you some plates with a number on each and every one of them, and I'm going to ask you to please let me know what number you see. And this is just to test if you can still see every color, if you don't have any issues with color blindness, okay? The first one, 74. What about this one? 12. 29. 42. 7. Pretty good. And the last one. Perfect. Okay, so now if you can follow my finger with your eyes only, please, without moving your head, okay? So let's start. Okay, did you feel any discomfort while doing that? No? Okay, good. I'm going to grab this flashlight now, and I'm going to check your pupil dilation as well as take a look at the back of your eyes. So I'm going to come a little bit closer and just keep looking straight, okay? All right. Good. Other side. Very good. All right. Okay. Okay. Everything looks good. Alright, let's move on to your sense of smell. And what I'm going to do is ask you to identify some smells. So those are essential oils. I'm going to place them right under your nose, and if you can try to identify them. Okay, so let's do the first one. Yes, orange. Very good. Okay, so the next one. Here it is. What do you think it smells like? Yes, lavender. Perfect. Okay, let's do one more. Yeah, this one is very strong and refreshing. Yes, eucalyptus. Excellent. Now for your sense of taste, I have these little containers, and I'm going to ask you to close your eyes and open your mouth so that I can place one drop of each of them, and if you can try to identify what you taste. Okay, let's do the first one. Okay, here you go. Okay. Yeah, take your time. Watermelon? Correct. Okay, let's do the next one. Okay, are you ready? Okay. cinnamon. Very good. Okay. And the last one now. Okay. Here you go. Peppermint. Very good. You are doing very well so far. I don't see any issues. Okay, now I'm going to check your hearing. So this is going to be pretty straightforward. I'm just going to place my hands on both sides of your ears and I'm going to make a sound. And I would like you to let me know when you can't hear the sound anymore, okay? All right, let's do. Now, again. Good. Now I'm going to ask you to tell me if you hear the sound on your right or your left, okay? Or both? Okay. Left. Right. Right. Left. Both. Very good. So now I'm going to check your facial sensations. So I'm going to ask you to once again close your eyes and I'm going to touch you with a dull object like this Q-tip and something more sharp like this. And I just would like you to tell me if it is dull or sharp, okay? Okay, close your eyes. Dull. Dull. Sharp. 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 Dull. Sharp. Dull. 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 Sharp. Sharp. Dull. Dull. Good. Now I'm going to do the same thing and I would like you to tell me where you feel the sensation, if it's on your cheek, on your forehead, on your chin, etc. Okay? Yeah, you don't have to say sharp or dull, just where I'm touching you, okay? Yeah. The chin, forehead. Yeah. Yes, perfect. something slightly similar. I'm going to use these two ice globes and I'm going to touch the two sides of your face, and just let me know if it feels the same on both sides, or if one of them feels a little cooler and the other one a little warmer, if you feel any difference, okay? All right, so same. 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 Okay. Okay. Right. Okay. Very good. Okay, so now can you blink for me, please? Can you smile? Okay. Can you puff up your cheeks? Okay. Good. Can you open your mouth? Can you move your tongue from side to side in your mouth? Okay. Right, so just a couple more things that I'm going to do and then I think we will be done. So I'm going to put on a pair of gloves. And I'm going to touch your jaw, okay? So just first of all, if you can clench your jaw pretty tight, okay? I'm just going to feel it. Okay. Now if you can open your jaw. Okay, very good. So now I would like you to move your head from side to side, and I'm going to try to stop you with my hand, but if you can resist, okay? So let's start with your left side. Okay, try to push to your left. Okay, very good. And now your right. Okay, very good. And the last thing, I would like you to shrug your shoulders, and I'm going to try to push down on them, but if you can resist, okay? Okay, so. Okay, very good. All right. So we are done. I did not detect any issues with your cranial nerves, so that was all very good. I'm going to give your chart to the nurse, and you can make an appointment for an annual exam or anything that you need at the reception, okay? Yeah, it was my pleasure. Thank you very much, and see you next time.